This episode is brought to you by Denver Bike Fest. Check out Denver Bike Fest Saturday, June 13th from 3 to 9 p.m. at York Street Yards. This free, all-ages celebration of Denver's bike community brings you live music from Boys with Blue, Modern, and Yugs. Plus, drinks from Cohesion Brewing, 8 food vendors, and 50-plus bike partners offering demos, workshops, games, and so much more. Roll up to the fest and take advantage of the free bicycle valet from Z Cycle Shop. Oh, did I mention we will be there? Come hang out with CityCast Denver as we keep the fun rolling on the main stage. Learn more about the celebration and sign up to volunteer at denverbikefest.app. That's denverbikefest.app. This episode is brought to you by the Vail Wine Classic. Head up to the mountains for this beautiful celebration of international wines and spirits, as well as Colorado's home favorites like Carboy Winery, Outer Range Brewing, and Woody Creek Distillers. Going down August 6th through the 8th, this big wine event features programming such as sommelier-led wine hikes, paired lunches and dinners at Vail's top restaurants, and an exclusive sunset showcase called Best of Fest, featuring 90-plus rated wines overlooking the Gore Range. Ticket prices go up as it gets closer to August, but you can save money right now by buying sooner. Just use code CityCast at checkout for $10 off. For tickets and a full schedule, visit VailWineClassic.com. And don't forget to use code CityCast for $10 off. Welcome to CityCast Denver. I'm Bree Davies, and here's what Denver's talking about. Today, we're discussing why overdose deaths are on the rise in Colorado, how drug busts impact drug-related deaths, a fentanyl possession bill heading to the ballot this November, and more. Executive Director of the Harm Reduction Action Center, Lisa Rayville, welcome back to CityCast Denver.
Thanks so much for having me today, Bree.
And you're back. I was like, you're back. It's been a while. But we have a sad thing to talk about, but I wanted to talk to you about this because you know so much about it. So the Denver Post reported that in Denver, 63 people died of overdoses in March, 58 died in April, 63 more in May, with March and May tying for the worst months of fatal overdoses on record in the city ever. Is that correct?
That's exactly right. That was in 2025.
2025. Okay. So this comes as overdose deaths across most of the U.S. are actually down, but here in Colorado, they went up. Lisa, why is this happening?
It is so problematic on the front lines. The grief is overwhelming. We think a few things. We continue to have an unregulated drug supply. This is the most toxic and unpredictable drug supply we've ever seen. People using alone, people using after periods of abstinence. We also know that there's barriers to calling 911, especially with the fentanyl criminalization bill from 2022. People being concerned that instead of getting, medical service, they'll get law enforcement. And then we also know that when police seizures happen of drugs, a new supplier comes into play, which makes the drug supply incredibly unregulated. So we had a huge increase from 2024 to 2025. And remember, in 2025, in March, April, and May, we were struggling on the front lines and only hearing about overdose deaths from Denver Police Department's Twitter. And it takes 12 to 18 weeks for the autopsy reports to come out of the Office of Medical Examiner. So we didn't even have our finger on the pulse of what the unregulated drug supply was at that time.
So what's finger on the pulse? Like you would know from, like you would know where it was coming from, or you would have an idea of like, how would that change things if you had that information?
Yes. So we want on-site drug checking today, and we're very close to getting it with the city of Denver. It's taken quite a while. It's taken multiple years, and we were really struggling and needing it last year. But when you have on-site drug checking today, you know exactly what's in the drug supply. Years ago, the Denver Police Department used to have their, crime bureau and lab would test. And so we would kind of know quarterly what was in the drug supply: nitazines, BTMPS, xylazine, medetomidine, in the fentanyl, things like that. We just don't know right now. And so we can send it to a lab, but it's a 2-week turnaround. So we are soft launching an on-site drug checking so people know what's in their drug supply today. So we have that finger on the pulse so people can do something about it.
I was going to say, what do you do when, okay, so I have a baggie, I
So now
get it
you know. Yeah.
tested. Yeah, like I'm still going to use, but like, what do I know that's different if I'm able to check my drugs?
That's exactly right. So you know exactly what's in it and you can do something about it. So you can use less. Some people let other people know who are purchasing from the seller. So there's a behavior change that can happen once you know what's in your drug supply. A lot of people will know about this from fentanyl testing strips. So those have been very popular for the last 10-ish years around the country. We've had them in Colorado for probably about the last 8 years where people can test their drugs to see if fentanyl or fentanyl analogs are present. Now, it's not going to tell you how much is in that drug. It's just going to tell you what's in it. So most of the time, drugs are cut with a lot of things, like lidocaine, acetaminophen, maybe fentanyl, stuff like that. So people will actually know what's in their drugs, and then they can do something safer, healthier, and more positive today.
This is probably a dumb question, but like, why would those things be in the drugs? Because fentanyl, it really takes such a small amount, right? So is this like filler that just like makes a pill, or like why are things getting mixed in when you maybe assume you're buying just fentanyl or just pills or
Yeah. So what we've seen with the blues, so fentanyl for us in Colorado is fourfold. It's very, very rare for it to be found in cocaine or meth. That's accidental cross contamination on the scales. Fentanyl powders here, that's a little newer to us. Sometimes it's being pressed into pills called the blues. There's a little fentanyl, a lot of fentanyl, or no fentanyl in those pills. So when we're talking about really the powdered fentanyl and the blues, the more drugs that you have, the more money you make, right? So it's usually cut, the more it comes down from the top. So by the time that drugs get to the street, it's a very unpredictable and unregulated drug supply. So, for years and years in cocaine, levamisole was in there. That's a pesticide. We're seeing xylazine a little bit in our fentanyl. Xylazine makes sense in that it lengthens euphoria of fentanyl because fentanyl is a shorter acting drug. It's much shorter than like a heroin. We're really concerned about medetomidine. Our colleagues on the East Coast, that's a veterinary sedative. We're concerned that might be starting to come into our supply. And fentanyl is already very sedating, which is why in the Denver Post article, you see that the Office of Medical Examiner said most overdose deaths in Denver have meth and fentanyl on board. So it's not fentanyl in the meth, it's poly drug use. Because fentanyl is so sedating, you need a stimulant, you need a meth, you need a cocaine to be able to push forward with your day. Because fentanyl really wasn't made for this kind of maintenance use because it's so sedating.
I was going to say I've been given it in the hospital, so
That's right. Very rarely, and years ago we all kind of knew somebody's dad that was on a fentanyl back patch, who had a bad back and stuff like that. That's a managed user with a safe supply. We know exactly what's in that.
This is part of the issue that it seems Colorado might be facing, or why we may be seeing these overdose deaths you're saying is because there's just not a lot of knowledge of what is in the supply that's out on the streets.
From day to day. That's exactly right.
So why are we experiencing this I think it was like Colorado and Arizona and maybe one other Western state was experiencing these higher rates of overdose. Why is the rest of the country not experiencing this? Like, why is it us, I guess?
Yeah.
I mean, that might be not a question we can answer, but.
Well, I do think some of it does have to do with some of the police seizures, right? You think you're arresting your way out of drug use, which is never going to happen and not possible. But what happens is a new supplier comes in, which then shifts the supply very quickly. So people don't know. I think, again, calling 911 is a real barrier from the 2022 fentanyl criminalization bill with the drug-induced homicides, making every fentanyl overdose death a murder investigation in the state. You don't get the cartel that way. You don't get the mid-level sellers. You get low-level sellers like friends and family members. And that's mandatory minimum 8 years. So when we double down on the worst ideas of the drug war, which are incarceration and criminalization, and we don't support folks being able to call 911 for a medical emergency such as an overdose, I think it's the perfect storm for us continuing to have issues, not only in Denver, but in the state of Colorado.
This episode is brought to you by the Regional Air Quality Council. Created from pollutants like car exhaust, ground-level ozone is the Colorado Front Range's biggest air quality issue and a leading cause of respiratory problems. But you can do something about it. Take simple steps for better air this summer by carpooling and combining car trips to save gas, or by taking the bus or light rail to get where you need to go instead of driving. And when you're parked in parking lots, at the trailhead, or when picking someone up, be sure to turn your car off and don't let the car idle with the AC on. But hey, why not get out of your car altogether? Walk, bike, or scoot shorter distances, or maybe try one of those cool new black and turquoise Vio bikes and scooters that are popping up all around town. And did you know there's still a $225 state rebate on e-bikes? And the city of Denver also has its e-bike rebate opening again on July 7th. Want to know when it matters most to take these steps? Sign up for summer ozone alerts by texting Better Air CO to 21000, or sign up for emails at the Simple Steps Better Air website. Learn more ways to help improve our air quality on the Colorado Front Range at simplestepsbetterair.org. That's simplestepsbetterair.org. This episode is brought to you by Energy Outreach Colorado. Energy Outreach Colorado is a statewide nonprofit helping income-qualified Coloradans pay their energy bills. If you're having to make tough choices like paying utilities or putting food on the table, Energy Outreach Colorado is here to help and ease that burden. Programs range from utility bill assistance to emergency furnace repair to community solar and energy efficiency work. So what does that look like in practice? Well, Energy Outreach Colorado's crisis services keep electricity, gas, and heat running with immediate bill pay assistance. But they also focus on the long term by investing in energy efficiency, electrification, and affordability solutions like community solar, all to help prevent future financial risks for families and neighbors who need it most. Learn how Energy Outreach Colorado is creating affordable energy solutions for Coloradans at energyoutreach.org. That's energyoutreach.org. I want to talk about the incarceration piece, and this legislation you're discussing is something that was passed in 2022 legislatively, but we are going to be looking at a ballot issue, which we'll talk about in a minute. But I want to go back to something else you were talking about, which in the last few years, I've seen several press conferences from the Rocky Mount Field Division of the DEA showing millions of fentanyl pills being seized in various busts. Like, I'm thinking about these big photo opportunities of baggies and bricks and pills, like the Douglas County bus last November, that they found 1.7 million counterfeit fentanyl pills in a storage facility in Highlands Ranch. First of all, is that a big bust? I mean, it sounds like a big bust to me, but I don't know what a big bust is. It's not.
No.
It's not. Okay.
Drugs sell themselves. No.
Okay. Because that, to me, I would read that and I would see that and go, well, that's a lot of drugs off the street, right? And that's a good thing to take drugs off the street. It just feels like so much, but you're saying it's not that much. And I also just wonder kind of what does it mean for us when these big busts happen? Because on the surface, it's like, great, we're getting drugs off the street.
Law enforcement will never arrest their way out of drug use, or they simply would have already done so. So it's like drugs are happening. They account for busts to happen. My folks are smoking between 5 and 20 pills per day.
Okay.
So, it's truly not that much, and they'll never arrest their way out of it. So, what we'd like to see is them to kind of shifting to be more supportive to, making it a regulated supply. So I think, people have used drugs forever and ever. People will use drugs forever and ever. We just have the audacity to believe that people shouldn't have to die of a preventable overdose. But the drug supply is going to be unregulated for the rest of our lives if we don't do something about it. And stigma, shame, and incarceration ain't it, or that would have already happened. So what we're looking for is a regulated supply. Remember, alcohol isn't legal because it's safer. It's safer because it's legal.
So what would a regulated supply look like for, I guess, street drugs? I don't know how to phrase it because it's different than being prescribed something by a doctor. This is what we're trying to address. Like, what would a safe supply look like?
Sure. And back to my example earlier of somebody's dad or uncle that was on a fentanyl patch, that is a regulated supply. And you could be a managed user with that. That's all we're asking for. Even methadone and Suboxone is a safe supply. You know exactly what's in it.
And those are
for opioid use, people are pushing forward with a life of treatment. So a true oxy out of a pharmacy is a safe supply. It's just people have only died in large, large numbers with the unregulated drug supply. We need to regulate the supply. And a safe supply happens in other countries too. Again, we had an unregulated supply of alcohol from 1920 to 1933, and people went blind and died and said maybe we should regulate it. We believe the very same should happen with drugs now. I mean, you gave that stigma, shame, and incarceration a try, and people have died, and they've died publicly, and we can do better than that. So, yeah, so a diacetylmorphine, a Dilaudid, an Oxy, something that's a true supply that you know exactly what's in it, a pharmaceutical grade. Right now, we have, clandestine labs happening all over, and people have no idea what is in the street drugs. So it's like, here's your supply bag with lidocaine, acetaminophen, maybe fentanyl, xylazine, and medetomidine. Have a nice day, And so it's like, the systems aren't even set up for everybody to go into treatment today. And treatment is very difficult to come by in Denver and in the state of Colorado, but across the country as well.
Yeah, I was going to say that's a whole other topic of like, I remember when
Right?
I was looking
I was like,
for,
we don't have time for that today.
no, I was looking for treatment for my family member who was in the throes of heroin use. And I couldn't find anything, even if we wanted to do something.
Yeah.
But I want to try to picture the other side of this, of someone saying, well, okay, Lisa, so your idea is to just set up a safe drug market for people that want to use drugs. Like, doesn't that making accessibility to the drugs, even if they're safer, just mean more people using, more addiction? Like, how do you explain it to someone who thinks, or, the perspective of like, why would we provide more drugs to people? You know what I'm saying?
I see. I'm looking for a regulated supply. This is a consumer protection issue. Right now, we know people are using drugs. What we also know is that we live in a society where we don't want our water tainted, and we want to make sure that our food isn't tainted. Just because people use drugs doesn't mean they don't deserve a regulated supply. Again, for my alcohol users out there, you have a regulated supply. You know exactly what's in it. You know exactly what you're purchasing. This is truly a consumer protection issue. And it's not like the stigma, shame, and incarceration folks haven't been giving it a big old try for 51 plus years on the war on drug users. And all that's done is cost billions of dollars and millions of lives for something that we know people are doing and will do for the rest of time. We need to regulate it. We need to know exactly what's in it, and then people can make that decision. We don't have people going out and doing strange things around alcohol. Well, people, people are doing strange things around alcohol.
Alcoholic, yes.
Good point. But, people are able to kind of push forward and know exactly, like happy hour. Happy hour is a safe supply in a use site. That's what happy hour is. Is if every single time the waitress asked you if you wanted to get into treatment, you'd say, what did she just say? Because drug use is for people who use it chaotically and non-chaotically, problematically and non-problematically, just like alcohol. So regulating the supply doesn't mean randos are going to start using. It means really, first and foremost, people who are using an unregulated drug supply will know exactly what's in their supply and won't die. I just want to believe that we're all on the same page, that we all want to make sure that people don't die of preventable overdoses. You wouldn't know that by talking to decision makers in Denver and the state of Colorado, because people are dying and dying publicly of overdoses, and there are things that we can be doing. Overdose prevention centers, reducing public drug use, reducing public overdose deaths, and increasing public safety, and a regulated and safe supply would do the very same.
Is there anywhere in the world that has done this idea of regulated safe supply? Like, I remember, I feel like I was talking to a candidate for DA a couple years ago on the show, and he kind of alluded to like, well, Denver could, but we don't want to be the first. We want someone else to try it first. Has this been tried or tested anywhere else in the world?
Oh, absolutely. It's happening in about 7 countries right now. If you know me and you've ever met me, you know that I have a binder of data and evidence-based. Obviously, Switzerland's doing it. Switzerland has done it right since the 80s. Germany, the Netherlands, Canada, Denmark, and Spain. It's always funny when people don't want to be first. I don't want to be 49th either. And so we need to be pushing forward in parallel. Then here's the thing, Brie. Last year in March and May, when 63 people died of an overdose death in Denver, most of them were public, meaning outside, in alleys, in parks, and in business bathrooms. Even if you don't care about people who use drugs, somebody had to find them. And that's a random community member or a kid that came up on somebody that had died. We had 6 overdose deaths in Denver just last weekend. That's 3 a
Oh my
day.
gosh.
That's egregious. We can do better than this.
Oh
I
my
know we can.
gosh.
And so we need to be trying evidence-based, data-backed interventions. And listen, we all support naloxone. Naloxone has been a lifesaver for years and years and years. Naloxone was brought to Colorado by people who use drugs, for people who use drugs in 2010, 2011. And then we went to the legislature in 2013 to make it legal for anybody in the state to carry it. So for the last 13 years, you can legally carry naloxone in the state of Colorado, thanks to people who use drugs. But you can't use naloxone on yourself. So a lot of times, you'll get decision makers that'll say, "Oh, well, just carry naloxone." It's like, okay, well, now they're asking random community members to also carry naloxone because we know people who use drugs are the true first responders, and we need random people to carry it too, when we could be trying other things in parallel. Reducing public drug use, reducing public overdose deaths, and increasing public safety. That's what we're about. So when people come to me and say this is not possible, it's absolutely possible. It's happening in other countries. And actually, quietly, some law enforcement actually supports a safe supply. It's regulated, it reduces overdose deaths, it gets the cartel out of the way, and people can push forward.
I just want to clarify for folks too, if you're not familiar with naloxone, this is an overdose reversal drug that's extremely easy to administer. Like anybody basically can do it, like you said. But that's an interesting point that it was made available and now we have been doing this for 13 years. I know tons of folks, from teachers to bartenders to to retail workers, who have gotten themselves, like a quick training and carry it around with them all the time. But it is interesting.
And I do want to say it is so scary to recognize and respond to an overdose.
That's what I'm
I know
thinking
that.
about.
If anybody in the world knows that, we know that. And that's why if somebody's overdosing, I would rather it would happen on site with my staff and I than in the world. It is scary. I'm with you. But again, there's other evidence-based, data-backed interventions we can be pushing forward with, and the barriers seem to keep coming.
Yeah, no. And my sister's a first responder. I'm like, where's Zoe? I need her to do this.
I know.
Because she's trained in all these other things, And
when you look around, you say, I need an adult. And you're like, shit, it's me.
I'm the adult. I'm the adult. I just want to read you this quote that I found really interesting from the Denver Post piece. It's from Ali Arnaz, the Overdose Prevention and Education Program Coordinator for the Denver Department of Public Health and Environment. She told the Denver Post, the drug supply in Denver is very different from what you see in Grand Junction. Lisa, what makes a drug supply with 250 miles between it different? I'm just trying to think about what we're facing as a state.
Yeah, I mean, part of that too is it's different day to day right here in Denver. So a different supplier could have Grand Junction that has Denver. What we have is I-25 and also I-70. So we are kind of at the crossroads here, maybe so bold, of what's happening. And, by the time something gets to Grand Junction 4 days later, it could be cut with something completely different that people would have no idea. Yeah. So, but I'd say day to day, right here in Denver, the supply is very different. Again, which is an issue that I think drug checking will really help to let people know what's going on in the drug supply. And behavior changes can happen where they can use less, throw the drug away entirely, things like that. But again, now you know what's in your drug, and it's just like, I just want it. I wish we could say, okay, this is regulated,
Yeah.
Because we have to be very clear for the audience here is, you can't just like bebop on with your day and be like, oh, I'm just not going to use drugs for the rest of the, I mean, fentanyl users and opioid users, if they use for any period of time, aren't getting high anymore. They're going from minus physical withdrawal pain, the flu times 1,000 to normal or well.
To just management.
So that's what we're talking about here. It's just trying to manage it to try to be normal and bebop along with the day. So, it's very, very dangerous to be in withdrawal, a lot of dehydration. That's why you lose a lot of people oftentimes when they're incarcerated because their withdrawal symptoms aren't, kept in check.
So I want to ask you about this measure that's going to be on Colorado ballots this November, and come with me on this journey for a little bit because I want to try to contextualize this for folks that are maybe not familiar with harm reduction or see the situation a different way. So this ballot measure, if passed, would make any distribution of fentanyl a class 1 felony. So like something as small as a person giving a pill to a friend at a party, they could be sentenced between 8 and 32 years in prison for that one pill. Correct? Is that
prison?
What,
Correct.
okay.
Yes.
It would also mandate court-ordered substance use treatment for people convicted of possession of up to 1 gram, which we talked about can be difficult to find. Court-ordered substance use treatment, is it available? Is it a lot available?
Where's that?
Okay. That's what I was like. I'd love more details on this. But I'm trying to just think about this. A voter that's going to the ballot, looking at it, and I'm thinking about, okay, I imagine this story I see a lot. 2 moms who have lost kids to overdoses, right? One of those moms might say, well, I want the person who gave my kid a pill that killed him to go to jail for their part in his death, while another mother might just not see jail as the answer. And so as a parent, I can see both perspectives here, but I wonder how do you talk to a mom of a lost child about this bill who might see incarceration as the answer?
Yeah, it's tough. It's very tough. And a lot of this has come up with the drug-induced homicide pieces that Colorado passed in 2022.
Will you explain that really quick? What was passed there?
Yes. So in 2022, as part of a larger bill package, if you sold somebody fentanyl and they died of an overdose, you are charged essentially as a murder in a drug distribution charge, and that's a mandatory minimum 8 years as well. We understand the grief, and the grief is very overwhelming. It's overwhelming on the front lines. We know it's overwhelming for families. But that is not the answer. Laws that increase overdose deaths do nothing to honor those that have died of an overdose. And my colleagues across the country will speak to that all the time. By the time that drugs get to the street, you have no idea what's in them. So friends are oftentimes selling to other friends. Most of the time, people that get the drug-induced homicide charges are friends or family members. And so again, because it's an unregulated drug supply and people have no idea what's in there, and quite frankly, drugs sell themselves. So doubling down again on incarceration and criminalization is not going to do anything to reduce the overdose deaths. What it's going to do is increase overdose deaths. The sale of one pill, or even just the sharing of one pill, is going to put an 18-year-old in prison for 8 years. I would definitely suggest a lot of your folks go to HBO Max and watch The Alabama Solution. It's an Oscar-nominated documentary, and it really gives inside glances of what incarceration looks like in Alabama and across the country, because folks that are incarcerated have cell phones in there and get that footage out, because no Department of Corrections across the country will allow the media inside of there. So that is not trauma-informed care. That does nothing to reduce drug use. It just increases overdose deaths. So what this is going to, when it goes to the ballot in November, is going to go and be way too far. And it's going to put, they're saying 900 people, an additional 900 people per year in prison. They say they're going to have to build a new prison per year in Colorado for the next 5 to 7 years. Now, the Colorado Department of Corrections already runs a $1 billion budget, and they don't even have the staffing. They also have the overdoses. Every single jail and prison overdoses happen, not only in the United States, but across the world. So doubling down again on the worst ideas of the drug war, which were incarceration and criminalization, are not the answer. All that the 2022 criminalization bill did was create a barrier for people calling 911 in the event of an overdose, which has increased overdose deaths. We've got to stop with that trajectory and shift. Why do we not have more access to prevention? Why do we not have more access to naloxone and harm reduction across the state? Why do we not have more access to treatment, evidence-based treatment? Methadone and Suboxone are the gold standards in working for people who use opioids. Methadone is in the clinics. It needs to be out of the clinics and into the pharmacies like they do in other countries. There are things we can be doing. putting people and 18-year-olds in prison for the next 8 to 32 years is not going to do anything except increase more overdose deaths in the state of Colorado. And again, I think we can all agree that we want to reduce overdose deaths in the state of Colorado. We're on the same team.
Well, and I was going to say, you could just look at the data too, right? This other bill passed in 2022 and our overdose deaths in 2026 are up. So that has been since that bill was passed.
Well, 2023 and 2025. So 2023 in Denver had 598 drug-related deaths. And then 2025, we're at like 563. Like, wild.
Yeah.
Wild. And again, it's so difficult to even call 911 because you're not only getting, tricky paramedics, but you could get law enforcement. I mean, I recognized and responded to an overdose the other day, and paramedics and law enforcement came, and I walked off. The guy's alive, thankfully, and I recognized and responded because some rando had called. We really don't even need paramedics at an overdose because most of the time naloxone works. It's not instant, but it also works in just a few minutes that we have. And so thankfully, we have a lot of people utilizing naloxone, but also Denver County jails utilizing naloxone quite a bit too. They came out with a report a few months ago.
How are people getting drugs in prison? Maybe that's a dumb question.
Jail and prison, baby. You can get drugs anywhere, anytime.
Okay.
And there's Bree, I'm going to blow your mind. There's prisons across the world that do syringe exchange in prison. Knowing every single jail and prison in the world drugs get in there, they want to make sure that folks don't acquire HIV and hepatitis C. Sure. Iran, Ukraine, Australia. I mean, wow. Everybody knows that drugs. So it's like, you're not even like taking people into like a drug-free environment, even if you supported incarceration and criminalization.
Yeah. So, I don't want to leave folks with just like, wow, this sucks. But is there one thing that Colorado could do today that could address our, that could bring our numbers down for 2026, or something to leave with folks who are hearing this and going, what do we do? What do we do?
I know, Bree. I've got a few things, me, just not just one. But we want to make sure that we're having really good conversations, and we need to be talking to everyone. We need to talk to middle schoolers and high schoolers. We need to be talking about, fentanyl is here. We were never too cute to think that fentanyl wouldn't come to Colorado. We need to really be talking about prevention and not DARE, which I know is back in the schools, and cops doing drug education is like nuns doing sex education. Doesn't make any sense. We need the safety first curriculum. We need to be on the same page and pushing forward with good prevention. We need robust harm reduction. We're engaging with folks today for a healthier and safer them. Harm reduction is under attack in the state of Colorado, and Loveland's having problems, Pueblo, and right here in Denver. If you support harm reduction and harm reduction initiatives, you need to contact your city council members and your mayors today. They need to hear from you. We also need to make sure that we defeat this archaic ballot measure that's coming out in November. So make sure you're registered to vote and tell 5 friends about that today. And again, I will never stop advocating for overdose prevention centers and a safe and regulated supply, because we want to reduce overdose deaths. And if you want to join us, let's get together. We need all hands on deck.
Well, Lisa, thank you so much for joining me.
Thanks for having me today, Bree.
That's all for today here on CityCast Denver. If you enjoyed this show, why not take a minute to tell the DEA Rocky Mountain Field Division about us? Rate the show wherever you get your podcasts, follow us on Instagram and TikTok, and subscribe to our morning newsletter at denver.citycast.fm. We'll be back tomorrow morning with more news from around the city. See you later.